Hi, my name is John, and today's topic is about healthcare. The title of this video is called Why There Are Shocking Costs on Your Emergency Room Bill by PBS NewsHour. And at the end, it says 1 in 5 Americans visits the emergency room per year, 1 in 5 US adults. So it's a fairly common thing. It's not something that's very rare. Almost everybody needs it at least once in their lifetime. The second article is from NPR.org, and the title of this article is called In British Emergency Room, There's No Card to Show. There are no bills. So basically, it says, for most Americans in London to see the games, a visit to the emergency room would be a truly foreign affair. Take the American tourist. A visit to a UK hospital after an emergency or accident would be free of charge. A trip to the doctor, the same. And you might be wondering how much it will cost. Here it says, a tourist visiting an emergency room in the US would encounter questions about insurance as well as a mountain of paperwork, and they might just leave with a bill. In the UK, the system is funded by taxpayers. It costs about $5.85 per day for someone making the equivalent of $30,000 a year. $5.85 per day. $6. $6 times 360. $6 times 360. Less than $3,000. Here's another one. I looked it up, and average healthcare cost for different countries. And it says here that from PBS NewsHour that the U.S. spent about $8,200 on health per person in 2010. Norway and Netherlands and Switzerland are the next highest spenders. But in the same year, they all spent at least $3,000 less per person. The average spending on healthcare among the other 33 developed OECD countries was $3,200. So you might be wondering which countries provide affordable healthcare. Norway, for example, it says all hospitals are funded by the public as part of the national budget. However, while medical treatment is free of charge for any person younger than the age of 16, residents who have reached adulthood must pay a deductible each year before becoming eligible for an exemption card. The card entitles one to free healthcare for the remainder of that year. And it says expenditure on healthcare is about $6,700 per person in 2016, among the highest in the world. Canada has affordable healthcare. The UK, United Kingdom, has affordable healthcare. Australia, Germany, France, Japan. And this article from Wikipedia, list of countries by total health expenditure per capita. From this chart, 1970 to 2016, America spends the highest percentage of GDP per capita on healthcare, even higher than the countries that provide affordable healthcare. What I don't really understand is if everyone gets sick sometime, then how come Americans are not doing something about it.